Dr. Auerbach, do sealants really work? Are they a good thing? And who should have them and who doesn't have to have them?
Okay. They are a great thing. There's two really main areas that teeth get cavities in. One is the chewing surface, those grooves right in the middle. There's parts of the tooth that fuse together that make those grooves. And sometimes those grooves are really shallow, which is good, but sometimes they're very deep and microscopic that bacteria can get into there. That's what a sealant does, is it fills in that groove to not allow bacteria to get in there and produce acids and make the holes in the teeth. So the sealants are wonderful. The other area that you get cavities besides the grooves is in between the teeth. Your saliva, your tongue, nothing can wash away in there. That's why it's important to floss the sides of the teeth.
So when you say grooves, I mean, are you telling me that those grooves are, let me say this, small enough for things to go in, but not big enough for the toothbrush to actually work it back out again or something like that? And thus you need
absolutely.
You need to seal them off?
Absolutely. To see bacteria, you have to have a microscope. And to see your bristle of your brush, you can see that with your eye. So absolutely, the bacteria are many, many thousand times smaller than the tip of your toothbrush, and they can get into little nooks and crannies very easily.
Got it. Now, how long do they hold? And I mean, at what age? When do you suggest to put them on? And how long do they hold? Or do they need to be then redone? And what are we talking about here? Okay.
Well, usually the first molar comes in at about age 6, which is the first back tooth that has those grooves in it. So we recommend they get sealed as soon as they're erupted through the gums enough for us to keep it dry and put that sealant on. The sealant is a kind of a flowing plastic material that hardens up either on its own or with a light to stick onto the tooth. Now, so we recommend even up through adults that everybody have their teeth sealed because you could get cavities at any time. It's really important, though, for the youngsters up through the teenage years. Those are basically what we find is the most cavity-prone years to have them on, but I recommend them on adults as well. In fact, I have my teeth sealed. Now, they don't last forever. Nothing does. And things that are really hard, crunchy, or gooey, especially your candies, like hard candies, Jolly Ranchers, gooey candies, Abba Zabbas, Mike and Ike's, all those kind of things can stick to the sealant and kind of pull them off. So you want to have them checked regularly, and if they start to come loose or parts come off, you want to have them resealed.
Got it. So basically, it depends a little bit on the eating habits of the person and maybe some other genetic habits, how much saliva and whatever it may be, and how he grinds or doesn't grind, of how long they last. But the normal regular visits to a dentist, which at a younger age, is that also more or less 6 months, give or take some other reasons?
Yes, 6 months is a good average, unless they have extra things that we need to take care of, maybe braces on, and we need to do it more often. Or if they're starting to get gum disease, for adults, we want to see them more often for sure.
So that 6 months visit, once sealants are on it, will be including of like, they're still fine, we don't need to do anything, or we need to slightly retouch them or something like that. Yes, it'll be okay.
Yes, that should be part of the routine. That is at our office. We check on those. We make sure everything's intact, and if we need to fix anything, we let you know.
Good.
So we can take care of it.
So sealants is a good thing. They seal things off, and even adults, you're having them.
Right.
And I don't even see them.
No, they're usually clear.
Well, all right. Thank you very much.